Testosterone with Deca-Durabolin, Test Deca. Is it worth it? I will be reviewing the benefits versus the risks because I see this so often. And this is not really for steroid users. This is for testosterone guys. Men that are middle-aged that may have some musculoskeletal pain and they love to use testosterone with Deca-Durabolin. This is a classic. Millions of men in the world are using this. So if someone you love is using this or considering this, or yourself, of course, please share this video and please always subscribe and like, because these videos are hopefully changing the world in education, open and progressive education for men that are using these agents. So this is it, the old classic, Deca-Durabolin with testosterone. Let's talk about Deca-Durabolin. It's an intramuscular anabolic androgenic steroid, and you can see all the videos I've done on this. This is going to be another video with Deca-Durabolin. It's a classic 19-nortestosterone medicine. It's actual medicine in America, and it's actually can be prescribed, unlike a lot of the other anabolic steroids that have been removed from the market or were never marketed. Like testosterone, it's strongly anabolic, yet it has less androgenicity, secondary to its reduction to a weaker androgen called dihydronandrolone. The bro science guys love this stuff, right? This is a mild anabolic steroid, and it also has a lower potential for estrogen conversion itself. Now, it's very interesting when you look at the clinical effects of this with testosterone and what does it do to testosterone with that aromatization and the effects clinically on the body. So let's get right into the benefits versus the risks. First off, benefits. Now, you're going to see it. This is, of course, with testosterone. So dose dependent, what do you see? You see men using TRT doses of testosterone with Deca-Durabolin or NPP, Nandrolone phenylpropionate, which is another supposedly less side effects than Deca-Durabolin itself. Okay, let's get some comments on that, guys. Let me see and hear your experiences with Deca or NPP with testosterone for this video. So the dose is normally about 100 to 300 milligrams a week when it's added to testosterone. So it's definitely anabolic. Okay, so it's definitely, the benefit is it's anabolic. You're going to get more recovery, more muscle building. It's basically very well tolerated. It just has low side effect potential. Again, we always hear about Deca-Dic and all these things, and we know that Deca can be used even by itself for TRT regimen. You want to see those videos. So it is well tolerated, there's no question. Now, the real secret is it's used for, because I say the shoulder, right? I'm moving the shoulder here. So guys have shoulder injuries, maybe knee injuries, maybe some elbow injuries are getting older, some osteoarthritis, and because it definitely in studies has been shown to increase collagen synthesis. Again, it's amazing, most amazing that it just is kind of like a chronic anti-pain medication. It just is, it's true, guys, and this is why men are using it with testosterone. Mood and sex next. Deca-Dic, you can see all this stuff, as we said, with proportional amounts of testosterone. We talk about 1 to 2, which is, or double the dose of testosterone, half the dose of Deca-Durabolin. Let's get comments on this, guys. What's your dose? What have you experienced? So mood, feeling uplifted, just feeling better with it without testosterone. Again, it starts that way, but does it last that way? Does it have the staying power? How many years have you been on Test and Deca? I want to hear it all. We want to get the compendium going. We want to really get a nice amount of comments here so men can learn. Okay, So those are the benefits, really more on musculoskeletal and well-being with testosterone. Is it sustained? How can you sustain it? Well, let's talk about the risks now. This is from my perspective as a clinical medical expert looking at men on testosterone, all other steroids, and this one particular combination, testosterone and Deca-Durabolin, for years. Number one is going to be the edema. It's actually called anasarca. That's going to be a medical term where the whole body has a subcutaneous edema, or it's filled up with fluid a little bit. You see men that are on steroids, you see their head actually kind of gets bigger, their face, their whole body, they have that big puffy look. That's technically not really edema, it's full body edema, it's anasarca. Now, anasarca, medically to physicians, they'll think, what? This is secondary to severe disease of the liver, the kidney, and heart failure. So, does it happen? Yes, it does. To what point? With testosterone, you're going to get a synergistic effect. This is because, in part, it's a strong progestogen. It's not really estrogenic, but it actually can potentiate the estrogenic effects of testosterone. Boom. This is really it right here, guys. So you're on Test and Deca, definitely going to have to watch out for the fluid changes, the fluid gain. What happens to that? Hypertension. That's a rate limiting step, guys. These are the secrets I got to give you. You got to clinically understand this. If you're on Test and Deca, if you're on Test alone and you add Deca, what are the rate limiting steps? Hypertension, you got to check your blood pressure. It's going to be dependent on so many variables, how old you are. Do you have propensity for hypertension? Do you have hypertension? So many men can be hypertensive just on testosterone. You got to measure the blood pressure, guys. You got to really check it. This is going to be a rate limiting step. So the fluid changes, the puffiness, the edema, it's really anasarca, guys, but that's an extreme term, but it's a real full body term. Hypertension. If you have hypertension long term with any means, it doesn't even matter if you're hypertensive because you're just getting older and you're not on steroids, you're a man or a woman, you're going to have enlargement of the heart. That's the LVH, left ventricular hypertrophy. Get an echocardiogram. Make sure that you see if you have LVH. You can do something about it early, guys. You could look at my videos. You can get on the app. You could learn what medicines. You can see a great doctor. Again, it's all about limiting the side effects. It's all about risk reduction. It's harm reduction. That's why I'm doing this. So LVH, that's left ventricular hypertrophy, the heart, the left ventricle enlarges, secondary to hypertension and the direct effects of the androgen itself. Ischemic heart disease. Now, if you have hypertension, if your cholesterol is not good, you have other medical issues, you're getting older, you have family history, do you have plaque in the artery? Get the coronary artery calcium score early, guys, if you're in the 30s. Or so, you have family history, you look at the cholesterol, the blood pressure, the pre-diabetes, please. Now, as far as the risks, dose is everything and duration is everything. The sheer amount of androgen is the issue, guys. It's definitely the issue. You're on testosterone, that's an androgen. You're adding Deca-Durabolin, that's another androgen. That's going to be a double androgen. That's going to, again, hit the body. You're going to have side effects potentially. Not everyone has the same side effects. What's your potential? How much salt are you ingesting? Okay, how much other medicines you're ingesting? Carbohydrates. This is really the topic here. You got to understand the sheer magnitude of the androgen collectively. You have to understand that. That's what it's going to be. Now, also risks, in addition to the cardiac stuff, right, that I'm talking mainly about here long term, it will worsen when you add Deca-Durabolin to your regimen of testosterone and then you stop it. You see, you're going to have some recovery. Your mood will come down maybe, or maybe it gets better because you need to stop it. And recovery, fertility, if you're going to be a young man on testosterone plus any steroid, classically Test and Deca, the recovery period and the ability for a physician to use drugs to recover you for fertility, like human chorionic gonadotropin, this is what we use, right? And I tell you guys openly, All right, it's going to be HCG, potentially with Clomid. Very complicated regimens. Good fertility urology doctors can do this. Endocrinology doctors can do it as well. And so if you're using more androgen, it just makes sense that you're going to have potentially a longer or a worse or more difficult time recovering from it. Again, recovery period. So the amount of time on, you're going to have the amount of time off. Again, this is with testosterone or without testosterone. Next, injury. Last piece on this risk is if you have a rotator cuff injury, of course I have all this kind of stuff, and if you're adding some Deca, oh, I know you'll feel great. I know it's a miracle. Test and Deca. Shoulders feel great. Elbows felt great. Even the back feels great. You're just stronger. It's anabolic, guys. You're adding an anabolic steroid to one that you have already on board. Of course, it's dose dependent. So if you have an injury underlying, how many times have I seen this or heard this, that now the rotator cuff gets worsened? You're going to actually, pop that supraspinatus. It's going to tear full tear. Now you're going to have surgery. You're going to be out. Please take that into consideration. So in the end, what's my summary? I have to recommend that, if you're on testosterone and you find that lowest dose of testosterone and you feel great, I can't recommend eating a steroid. First of all, there's no recommendations here at all. It's just giving my information to you guys. Using Deca, it just seems like most men, they can't use it forever. I know some of you guys do, and I want to hear it. What did you do? Why can you use it forever? Do you really know your calcium score, your blood pressure, your echo, your left ventricle size? What's going on with those things? How can you do it? So the problem is it can't be sustained. So why would you start it? Because if you start it, you might like it, and then you're going to have to come off. That's my whole trick here, guys, sustainability. So you want to monitor if you do. Again, what I've heard from guys is the dose usually is like 100 a week that they'll do, and they can sustain that for a pretty long time. I don't know if you can sustain it forever. I've really never seen anyone on it forever, and what is forever for you? So blood pressure, you got to check the blood pressure. You got to check your lipids, the comprehensive review of your Framingham risk factors. Lipid, you're going to see if your HDL is low normally, and then you're on testosterone, you've pushed your HDL, that's the good cholesterol, lower. That's going to be potentially dangerous overall for your heart. And then if you're on Deca, HDL goes even lower. Again, it's an additive issue. Calcium score, I said it again many times, get the coronary calcium score. You're in your 30s, you want to see if you have the beginning of plaque. Please, life-saving. Echocardiogram, you want to see the left ventricle. Keep the salt down if you're going to do this, or just your life, you want to keep blood pressure down. Keep salt, total sodium chloride down. I think less than 1,800 milligrams, or certainly less than 2 grams a day of total salt. Some people have to go under 1,500 milligrams. Carbohydrates, whatever kind of carbohydrate restrictive diet you need. And I love high intensity interval cardio. I love the sauna if you can get it. I love exercising so you don't get injured sustainably. Take breaks. If you're going to be on this stuff, if you're going to do it with testosterone, it seems like guys will have to take breaks. But again, the concern is that if you take a break, you're going to be off it. You're going to lose the musculoskeletal effects, maybe the mood effects. Of course, the sexual effects are varied. And guys, in the end of the day, I'm accessible forever on the anabolicdocapp.com. This is an uncensored medium for me. You can get in there and you could hear the amazing things we talk about with men all over the world. I really hope this helps you guys stay strong and healthy.